Good morning, everybody. My name is Aaron Oakes. I'm a managing consultant here at JRG Advisors, and I want to welcome all of you to our weekly webinar. The title of this webinar is New Technology That Enhances Employee Benefits, and so we'll be walking through that shortly. I just want to let everyone know that you will get a copy of the PowerPoint. You also get the webinar replay and a copy of the questions and answers that we gather throughout this conversation. And if you do have questions, please type them into your question box. It'll probably be on the right side of your screen, and then hit send. And at the end of the webinar, we will go through all the questions and answers, and we'll give you the answer live. If we can't, we'll certainly get back to you, and we'll let you know that. Thank you. So I want to welcome all our clients and our partners. We don't say it enough probably in day-to-day activity, but we really do appreciate your business and the support that comes from all our associations and clients out there. It's what makes JRG a great place to work and a great place to be in business. So thank you very much. Today's agenda, we're going to talk about technology, as I mentioned. We're going to talk a little bit about the effect on employee benefits, and that's kind of a vague overall umbrella. So I want to drill down a little bit on what it actually means on a few specific examples, and those being risk assessment tools, private exchanges, compliance assistance and fulfillment, employee health management, and the Affordable Care Act, the ACA employer mandate. And then we'll go into some questions. All right. So first, technology. Now, technology is a big term, and it's affecting everything in life. But the way it's affecting benefits, I want to drill down into a couple things. The one thing that we're seeing more and more is the delivery to employees. So here we're talking about electronic enrollment, electronic billing, whether you be an individual or a group, meaning a company. And it's enabling the expansion of offerings to employees. So at one point you could only maybe have health, dental, and maybe vision if you were lucky. Now we're going into more and more offerings that are on a voluntary basis to employees. And so it creates a value to those employees that they can't get other places on their own, or if they could, it's a little more difficult. The technology also is enabling risk analysis and transparency that we have not seen before, specifically on groups that are smaller to mid-size in scope. And so at one point, you probably, as a client, you couldn't get a lot of risk analysis or transparency of claims or any kind of data unless you were maybe 300 employees and up. And that wasn't all that long ago. Today, you can, as a group of maybe 20 or 25, even down to 10 sometimes, you can get into arrangements where you can see risk, your risk of claims, your risk data that's coming in, and you can do analysis on that, or a consultant should be doing that as well. So that's really exciting. The days of being in the dark as far as what you are as a group and the risk that you represent are slowly fading away, and that's being accelerated actually by ACA and community rating that is in place. Also, compliance on employer level and compliance on employee level, both are important, very, very important, and technology is bringing to bear the means to kind of fulfill all those compliance obligations faster and more efficiently. And of course we have employee health management, and in that we're talking about the delivery of employee health management programs, i.e. used to be called wellness. It's becoming more robust than that, and the monitoring of those programs as well. So let's dig into this just a little bit more. So when I say risk assessment tools, a lot of times this is linked into determining if an employer should really look at something called self-insurance, and otherwise known as ASO, otherwise known as level-funded programs. In any sense, next week we will be having a self-funded specific webinar, and I invite you to join us on that. It's something we've been talking about for about a year or more, The market is moving that way for those employers that have a nice risk. They can move into a self-funded arrangement. But before you even consider that, one of the things that technology is allowing us to do is risk assessment. And risk assessment meaning, hey, we have your group, and we're going to do a strategic analysis on your group and what claims and what kind of things are going on within that group that represent risk. One of the ways you can do that is online medical questionnaires. If many of you probably have gone through at one point or another medical questionnaires via paper, and that would involve your employees filling out a lot of paper questionnaires. There's an enormous chance for error when that happens, or lack of signatures, or what have you. And so that's an onerous process on any kind of HR department to even attempt that kind of gathering information. And even when you did collect that information, you would send that into a carrier, and oftentimes you would just get a rate back or just denial to quote. These days, what folks like JRG are doing are gathering the risk and gathering those questionnaires and then presenting you with a risk assessment. That risk assessment tells you if you are qualified for self-funded consideration, or if you're not, what is really going on with your group. And so it gives you a lot of insight into the dynamics of your employee base, what's going on within that employee base. For example, do you have a lot of diabetics? Do you have high blood pressure? Is the obesity BMI rate way above average for your group, or is it way below? Those kinds of things. Things that affect rates, things that affect your insurance. And so through strategic group analysis, you can do actuarial, census, and predictive modeling. So you don't actually have to do medical questionnaires. There are ways that we can gather a census these days, and just based on the census and maybe a Social Security number, that can be bounced against many national databases, and we can do actuarial-based predictive modeling, meaning we can kind of predict with surprising accuracy what your group is going to do in the future and where they are today. The other thing we can use is biometric screenings, for instance. That's basically taking blood of all your employees, and then you create a baseline and really do some research, again, using a lot of sophisticated actuarial modeling tools of what is going on with your group. And you can really see that based on just a blood test and some screenings, all all anonymous, and you can get aggregate data and aggregate reporting back, and it really doesn't identify anybody, but it does tell what your group is doing and where it may be going, good, bad, or indifferent. So what are the results of all this technology around risk analysis? Well, ultimately, you're looking at the possibility of lower rates, and lower rates based on your actual risk. Today, if you were in an ACA-rated pool, meaning if you're under 50 employees and you were in the ACA-rated pool, you could either be subsidizing or gaining from the pool you're in. Okay, so you could be actually subsidizing your own competitors, for instance, if you had better than average risk. So that's something you really need to know and want to look at. You also want to appropriately design your plans based on your risk. If you have a relatively low risk and no one's going to the doctor, for instance, there's no reason why you may not want to consider raising your deductible to a higher level. That might make more strategic sense for your business. And just knowing your risk, not only on a yearly basis, right at renewal time, but if you are in a self-funded plan, for instance, you can start to see your claims and all your risks coming in on a monthly basis, and especially putting that all together on a quarterly basis along with your consultant. That should be able to be a good predictor of what's coming to you in the future. And then let's suppose your risk analysis is fairly poor and that your risk is poor. At that point, you want to design a program to improve your risk. You can design action plans to influence behavior, for instance, influence your employees, and I would put that all under something called employee health management, where you really start to baseline and say, can we improve our risk and thereby improve the lives and productivity of our own business and the lives of our employees. Another big technology advance that's been happening lately is something called a private exchange. And You may have heard of the marketplaces. Well, I'm sure you have. The federal government marketplaces, all those kinds of things where insurance is offered to you on an online platform or an electronic-based platform. All these things can be lumped into something called a private exchange. Private exchanges sometimes are offered by a carrier or an insurance company or a broker such as JRG. So you would be offered a private exchange. The things that private exchange brings to you are kind of the efficiency that your HR department may desire. For example, it would enable you to do online enrollment, and so the paper and all the paper that's gathered during enrollment time, that goes away. It's offered to your employees via an online portal. So you eliminate the paper that's all involved in that, and signatures and keeping those records. And at the same time, you can increase employee options. So on a private exchange, one of the advantages is that you may offer not one health plan, but maybe 3. And one of the highest deductible product may be your base. And then all of the other 2 products may be a buy-up. You can create a virtual wallet, for instance, where you can take advantage of defined contribution, meaning you can give your employees a certain amount of money for all their benefits, and as they use that money for the benefits they select, that virtual wallet goes down, and they use their money and they can see what they're using it for. And the interesting thing is you can offer multiple health options, multiple dental options, multiple vision options, and dental vision can be voluntary and or group paid, and you can offer voluntary type products, meaning accident, cancer insurance, products that are oftentimes offered through Colonial or Aflac, for instance. And even we at JRG are even exploring the option of things like pet insurance, all based on either a voluntary basis where the employees are paying that out of their own pocket, or on a company paid basis. The advantage, even if it's voluntary and it's coming out of their own pay, the advantage of it is that the employees feel that they have a value that's been added to their benefit package. They have the opportunity to access insurance products on a group level that prior to they would not have been able to get on their own. And so it's a great advantage to them. And as deductibles rise, the voluntary type products become more and more valuable. For example, if you have a $2,000 deductible, your son or daughter has an accident on the playground, they have a broken arm, not only are you going to get hit with the deductible, but on the positive side, if you had an accident insurance policy, they would be getting money back, and that would help them out on those kind of situations. So it's really key to consider that kind of package as deductibles rise, and they are rising every year. So I've talked about employee choice, but what that really brings is an empowerment factor to your employees. They now have the power to see all their options and to pick the one that makes sense to them. And of course, I mentioned that it improves your employer admin efficiency, meaning we can set up carrier data feeds, and it improves your compliance as well, because you have a record of what everyone did, and that's the very beginning of compliance under ACA. So that feeds everything that you're going to do ongoing. Now, compliance, I would argue that compliance these days is becoming as or even more important than the benefits themselves. Part of the thing that technology brings to the table is the better ability to be compliant with the things that you need to be compliant with as an employer. First, there's the Affordable Care Act and monitoring all your benefits and the tracking that goes along with that, i.e. 1095s, 1094s, all those things that need to be done, that can be tracked with technology and should be. If you're not with a good payroll provider, for instance, or a system that makes that possible, it's very, very difficult to do these things by hand these days. And so it's important. If you are an ALE or an applicable large employer, it's very important that we start to look at this. And if you have questions about that, of course, call JRG. But it's very important that we use that technology that's available to help you be compliant. Now, it's not just the IRS and the ACA via payroll, but also the very important thing to keep in mind is that ERISA is becoming more and more important. ERISA is something, if you've attended some of our other webinars, ERISA compliance has been on the books since the 70s. However, most employers have not been fully or 100% compliant with those regulations. Many people think that ERISA has everything to do with retirement, but it's more than half to do with benefit packages and health plans. And so it's important that we start to use technology in not only tracking what your employees have, but how are you fulfilling your ERISA requirements? For example, are you aware that there may be upwards of 20 notices that need to be sent out every time someone enrolls, every time an employee comes in? Are you using technology to fulfill your COBRA obligations? Are you aware that there's over 6 COBRA notices that have to go out at any given point in time? And are you sure that those are being delivered correctly? And are you using technology to make it more and more efficient for your own company? Yes, there are costs to technology, but the point of technology ultimately is to take back the time and expense that it takes to do all this stuff in a manual sense. Okay. Now let's talk a little bit about employee health management. I mentioned it a little while ago. Most times people talk about wellness. They're talking about point-and-click wellness programs, and those still exist. It's online wellness. We're talking about assessment and assessing your risk as a person, saying what's wrong and how can I make improvement? Is it diet? Is it exercise, etc.? Most people, it's both. Can I relieve some stress in using exercise, etc.? Not to belabor the point, but you can obviously track all that progress online, and that's been in existence for a while. The difference is now you can start to baseline things as an employer. If you really want to get into employee health management, you want to create baselines and goals and improvements plans for your employee base. One of the ways to do that is to do, as I mentioned, biometric screenings and analysis, and so you create a baseline using biometrics, and the biometrics don't lie. So health risk assessments that people may fill out online, you know, on an average, you're going to get aggregate data back, but the honesty of those people, it depends on how honest they really are with themselves and with the assessment, and there might be some fear around, hey, how am I answering this and what it's going to do. Biometrics, on the other hand, really just tell you what's going on with your employee base directly. And you can track that progress, and you can really start to tie your incentives and pricing to your employees around biometric screenings and improvement plans and that kind of thing. Now, of course, there are ACA regulations around all those kinds of programs as well. Again, we're back to compliance. But the technology around biometrics is very, very easy, and you can get reporting back from that. Again, tying into your risk analysis that you should be doing. And of course, we have electronic delivery of care. This is something that I talk about in a lot of meetings that I'm in. Electronic delivery is something that many employers are not really educated on, and employees especially are not utilizing this. In most of the health plans out there today, integrated in a health plan is the ability to do telemedicine. And you can do this via usually something like a Skype or video transfer back and forth. You can do it via telephone call. You can do it via simple email or messaging back and forth between you and a nurse practitioner, a PA, or a doctor. The advantages to this is to the employee is obviously convenience, but it's also cost. And cost to the employer and cost to the employee, they can save. For example, a lot of the programs may have a copay that you pay that's less than an urgent care or a pediatrician or a regular doctor office visit. It may be lower because you're not going anywhere and you're not taking up doctors' time in an office where there's overhead. It's simply electronic, and so there's cost advantages to that. It increases access to doctors because it increases it to 24 hours a day, for instance. you can have the opportunity to talk to your doctor anytime you wish, and therefore it increases your accessibility. Or if you live, for example, if you have employees that live in rural areas and they can't always get to the doctor, it does help them out that way. And the other thing you can do is you don't have to rely solely on a program that's integrated into a standing medical insurance program. You can actually purchase these telemedicine programs on their own, and they're relatively inexpensive, and they can add a lot of value. For example, in those instances, you may be able to find, or you can find, I know for a fact, that you can find programs that do not include a copay at all. You just pay, as an employer, you might want to say, I'm going to sponsor this for you, and to call that doctor or to get them online isn't going to cost you anything. And therefore, instead of the employee paying a copay at a doctor, they're paying nothing. They're using a separate service, but it may be a great way to reduce costs. Okay. So under the Affordable Care Act, the employer mandate, a lot of the things, I'm just going to reiterate this. This goes for ERISA too. If you have large employers with 50 or more, and if you're an applicable large employer, the things that you offer might include or have to include minimum essential coverage, and that would be called a MEC. A lot of the technology that's around online enrollment and electronic platforms also exists in minimum essential coverage plans as well. So if you're an employer that must start to offer benefits and has not in the past, then electronic platforms for MEC might be a great answer for you. You can offer that to all your employees at once, and therefore it's offered, and then they can pick up that coverage as they need to. So it's a great way to use that technology and get it out there and also be compliant with ACA. Okay. Sticking to my little rule to be around 20 to 25 minutes, we're finished at this point, and I would invite you again to type some questions. If you have any questions in the box on the right-hand side, at this point we don't have any. So I'll wait just a few minutes, and I welcome you to, if you have a question, I'll stick around and we will answer those. Okay, we're not getting any questions right now. I do want to invite you and remind you that we do have a webinar on October 19th at 10 a.m. It'll be myself giving the talk. And again, I want to remind you that this one will be about self-funded insurance, or self-insurance as it's sometimes called, or ASO. This is really important if you're any kind of group that is basically 10 employees and up. It's very important to know what this product is, know what it means, know the structure of it, and how it can help you become a better and more cost-efficient employer. Okay, with that, we don't have any questions today. I want to wish you a happy rest of your week and a great weekend, and we will hopefully talk to you next week.